Hello, my name is Megan. I'm pretty much going to be doing the slideshow for infection prevention and control. This will be the introduction. This is going to pretty much go over the fact that the program first started in about the 1950s. Its changes have been used for professional, nonprofit organizations, scientific information, and to better patient care in a whole from staphylococcal infections. This brought safety to patients to remove also hospital-associated infections, which are HAIs. I will have to currently ask people to forgive me because I am still a little sick, so if I'm not reading clearly, I'm very sorry. But the modern concept of infection prevention and control also includes areas beyond hospital-associated infections, like risks to employees, cleaning maintenance, evaluations, physical environment, health policies, and various other adverse events. The infection prevention and control professionals need to be alert to changing recommendations and requirements because it is such a fast-growing department and association so far. It has been rapidly changing its ways and means it's finding new things and different aspects in the hospital that have opened up pretty much new ways to handle different bacterias, pathogens, and different ways to handle tools. Pretty much the infection prevention and control practitioners must have a good understanding of epidemiology, so the understanding of frequency, distribution, causes, controls of disease in the populations. They have to be aware that there are possibilities for outbreaks of this stuff, and they send off this information. Currently, we send it off here in Jacksonville, Florida, off to Atlanta, where they assess this stuff. They send it back, and they're actually able to tell whether specifically somebody within a hospital hasn't been able to officially follow these procedures and or hasn't done it unwillingly. They send it back, and they can tell whether it's within the hospital, and therefore the hospital will then investigate the situation. The doctor is handling all this, and it pretty much keeps a safe environment. The infection prevention and control also has a good understanding of microbiology and the risk factors for transmission of infection and disease. So, of course, whenever they are assessing this stuff, they send off their positive blood test, or goodness, it's pretty much if somebody takes a blood test and it pops positive for a specific pathogen and or something that has come up, they send it off, they write down the report, they handle the survey and what might have been a part of it. They get the information that has been written down, and they write down their part and report of these positive cultures. They push it forward. They send it off after putting their input in. They have to be able to understand what's going on. They have to be able to understand what they're looking at, what the culture says, what they have assessed so far, and what to send off to Atlanta. So some of the basics include standard precaution guidelines, including hand hygiene, respiratory hygiene, cough etiquette, appropriate use of personal protective equipment, safe work injection practices, environmental cleaning, as well as patient placement are all pretty much elements essential in breaking the cycle of microorganism transmission. Applications of standard precautions is the first step in breaking the cycle and preventing transmission of microorganisms between healthcare professionals, patients, and the environment. What the practitioners look for, and forgive me if I blank out because I get nervous during these things. A hospital-associated infection, which is an HAI, is anything to do with and or associated with a hospital or medical facility and a potential coordinated outbreak. Central line associated bloodstream infections, class B. It is a central line infection in the blood. So let's say next thing you know is you're at the hospital and somehow you now have an infection in your aorta or your supravena cava, something along the lines of your central line. That is what that would be. Now, BSI is a bloodstream infection when there is no central line in place. Catheter-associated urinary tract infection, it's when a catheter is stuck in and next thing you know is now you have a urinary tract infection, and it can be multiple different things. This is a rather large one because there's a lot of stuff that can go on in that section. I mean, get a blood test, send it off, next thing you know your culture is just like positive. Surgical associated infections. This is whenever you have surgery. I mean, let's say you have your Achilles tendon cut. Next thing you know, you get back in, not from your own personal mistreatment of the surgical site, but let's say you're in the hospital and told to sit here for a while because you will not be able to walk. Your leg is too weak and it's too much of a risk with such a huge surgery to try to go ahead and walk out with crutches. So they tell you to stay in the hospital, and next thing you know, your surgery or surgical site is now infected, but with a specific pathogen or bacteria that personally has been recorded by another patient. So now you have a coordinated outbreak. It is hospital associated. So we've got the standard precautions. Standard precaution is a practice to all patients in a healthcare setting. The basic concept of standard precautions is to treat all patients' blood and body fluids as if they are infectious material. This could be more of an example than anything. This concept specifically came from the bloodborne pathogen standard directed by the Occupational Safety and Healthcare Administration, OSHA, in 1991. Transmission-based precautions, in addition to standard precautions, are used for selecting patients with specific diseases or pathogens. Transmission precautions include contact precautions, droplet precautions, airborne precautions, and protective environment. To select a patient and see that they're coughing all over the place, you don't know if they are specifically contagious yet. They could have a very contagious sickness that is actually airborne, and you don't want an outbreak to break out in the hospital or for other people to get sick that already have weak immune systems that are staying there to get further, to pretty much get to further receive other contaminants and or get sick more than they already are. This goes back to contact. You don't want to be carrying some type of specimen and or touching things that, if you're not using hand safety, could possibly contaminate other stuff and or other patients. Examples of droplet precautions prevent transmission of diseases caused by large respiratory droplets that are from coughing, sneezing, or talking. Some of these diseases are influenza, pertussis, and bacterial meningitis due to Neisseria meningitis. Personal protective equipment, PPE, used in used as a surgical mask on patient room entry. Use gloves when touching the patient environment. The patient must wear a surgical mask when they are taken out of their room to other departments in the hospital. These precautions are kept so that obviously the transmission between patients and other patients in the hospital do not end up spreading. Protective environment is used for patients who have had chemotherapy. It's pretty much used while they're trying to lower their white blood count. This would be WBCs, before receiving a bone marrow transplant, which is the BMT. These patients are immunocompromised. The patient's rooms have filtered incoming air with high efficiency particulate air, which is HEPA, filtration that is at a positive pressure with relation to the corridor. When there is construction going on around these patients, or when there is construction going on around these patients, or when they are when they are taken out of their rooms, they should have an N95 respirator. This is also another precaution specifically for the reason that means they are immunocompromised. They have to have, they themselves can't fight off a lot of infections. So if there's stuff going around the hospital, they have to take precautions so that they personally don't end up getting other stuff. Means their white blood cell counts are low. That means they don't have a lot of their immune system there. They don't have the ability to fight off stuff. So they take these precautions specifically for those patients. So for the cited page, I went ahead and remembered to put down everything that I used for my research. This is all for the credibility of people that obviously came up with this research before I was able to even acknowledge its existence. I give technical responsibilities to Dr. Rodrigo Perez dos Santos because he actually did a specific little gram that I used in my previous slides, and it was actually from a medical site. So I wanted to give recognition to his technical support because he was able to put that all together. He needs recognition for that, but also because of the APIC, which I used most of my information for. It was the textbook for epidemiology and infection control. It was the 4th edition, and Dunham R. He was the symptoms and transmissions writer for the specific little website essay/article that I found for C. diff foundations with Mr. and Miss R. Dunham. That was done in 2008, guys. And then last but not least, I added a link, which I should have added more links. I might just go ahead and do that. Means I am officially done. But thank you guys. Thank you so much again. Thank you for watching. I just wanted to thank everybody for reading. I know I'm a very awkward speaker. I probably did horribly on my presentation, but you know, the final conclusion to this PowerPoint and the final conclusion to what I just previously explained in those previous slides are pretty much that the medical field has grown with new positions and new things in the past like 50 to 60 years, and one of those being the infection control and prevention program. The conclusion to it is all about safety. It is all about higher and basic medical experience between epidemiology, biology. You have to be able to understand procedures. You have to be able to understand medical terms. If you get stuff inside of these, if you get specific files with certain positive cultures, specific problems that have arisen where a patient has come up with an outbreak, of course, you're going to have to be able to understand what you're reading, what you personally are looking at, which you have to be able to understand once you've read to come up with a conclusion on how to fix it, because this is a field where they work with the prevention of something, and to prevent something you have to understand what is going on in the first place. And this whole field has come up with specific rules. They work with different departments, they work with different associations and different scientific organizations to help better these patients and the whole hospital environment. And without any basic understanding, you aren't going to get anywhere. You're not going to get anywhere in this field. So it is a huge part of its everyday work. You are going to experience this every day, and you have to be able to understand certain bacteriums that come up with this pathogen, spores, disease. Like, it's all a part of infection control and prevention, and just reading on it, I've learned so much stuff that I wouldn't have even thought of. I mean, I've had a little bit of thought, but in general, it really does help. Again, thank you for your time. I give a giant thank you to my current professor, Dr. Sarah Finch, for giving me the chance to further my career, and I hope nobody just heard my stomach growl because that was really loud. I hope to succeed in the future. I hope that she gets to watch and she loves this. I'm getting more awkward as I talk, so it might just be good for me to just say my watch is ended and goodbye. Yes, I'm a nerd. Bye-bye. See ya. Have a great day. I'm out of this and winter is coming.